guys, welcome to my YouTube channel. For those of you who are new to my channel, I am Dr. Kiki Molao. And for the returning subscribers, thank you so much for tuning in once more. In today's video, I just want to talk about to the medical students, or even the final year medical students, or even the training doctors, about studying methods that I used during my medical school that helped to prepare for exams, or that you could use that might help you actually prepare for your exams. So yeah, before I go any further, I just want to say, guys, thank you so much for 500 subscribers. It's amazing. It's been an amazing journey, and this journey, it has bloomed because of you guys and your support, your constant comments, your constant likes, your constant shares, and growing the channel. I am so grateful, and I believe that we're going to grow more and more this year. So before you can actually prepare for an exam, I feel like at the beginning of medical school, or yeah, you should find your people, find a study partner or a study buddy or a study group that you can actually meet up with, maybe after a week or after 2 weeks, to meet up and discuss certain topics, or yeah, or discuss certain patients to meet up with. And then yeah, it can be a group of one, can be, I mean, a group of two, can be a group of three, group of four. Yeah, you can choose how you can maximize this depending on the people that you would like to be in your group. And make sure that you choose people who are actually willing to prepare for topics should you guys decide or agree that you would discuss a certain topic. Let's say in a week's time you both want to discuss hypertension, diabetes, and STIs, for an example, and you are three. You should choose people who will be able to go through the topic in thorough, and then just give you guys a full informative discussion. People who will communicate well and not always come up with excuses. I think that's one thing I failed to do at the beginning of medical school, but towards the end of medical school, I had a few people that I used to discuss topics with, so it really actually helped me a lot, and I've seen how much of a difference it made, and I had wished that I should have used the method at the beginning of medical school. So if you get it that one right, then I think your journey into preparing for exams will start. Secondly, I think get your times right. Know if you're a day person or a night person. That's very important. I know myself that I study well at night, so after hours, after either clinicals or after lectures, I'll come back home, sleep, and wake up at night, study, and I can study until the following day. That's how I was productive, or that's when I was productive during the night. During the day, I wouldn't be productive. I'll still be tired, and I'll be thinking about a lot of things, and my mind will be filled with a lot of things. So if you find your time, you know yourself. Sorry guys, the video cut. As I was saying, I firstly just know when you're productive. Is it during the day or is it in the evening? If it's during the day, just make sure that when you get back from your lectures, either they end at 4 or 3:30, just get home, get a quick nap, power nap, 1 hour, 2 hour nap, wake up, then get going with the studying. And yeah, and if you're a night person, quickly when you get home, just make yourself a snack, sleep, wake up at a time that you know that you're efficient. I used to wake up at like 12 or 1 o'clock, then I will study until in the morning. Or I would rather wake up at like 10, then sleep again at like past 3 in the morning, then wake up again in the morning. So you just have to find your the time in a day where you're more productive. Don't worry about people after school going to the library and acting all productive. If you know that you can't, the library setting is not for you during the day, you can't study, don't do that. Just go home, have a rest, and wake up. And if you're staying at a residence and then there's a study lab or a study area, just go there at night, just study. So yeah, that's the second thing I want to share. And the other thing, while noting the study routine, make sure that you have a study plan. That's one thing I used to fail at. Just to draw up a timetable per day, like, okay, today I want to cover 1 2 3, tomorrow I want to cover 1 2 3, the following day I want to cover 1 2 3, which is something that I'm using now during my internship, and it has been working. The only days I'm not studying now is when I'm tired. So just have a plan, a timetable plan to say, okay, today I want to cover hypertension, tomorrow I want to cover diabetes, tomorrow I want to cover that and that, so that you know you follow a plan so that you're not, tomorrow you're not here, and then the next day you're there, and then you end up not covering or doing anything. So yeah, that's the other thing I just want to share with you. Also, the fourth thing I just wanted to share is the study tools. You know, the more people you network with, the more you'll find different study tools, different apps. Maybe there's a good app for surgery, there's a good app for gynae summaries, there's a good app for pediatric summaries. So just network with people. I am not sure at this time what's the app that is just circulating or whatever, but what I used to do is to watch YouTube videos. I have written down a few that I could remember, or that I'm still using even now, and I was using them during medical school. So YouTube, I used to use Osmosis. As you know, they are quick, straight to the point. It's like mini summary to the topic, but they'll give you sample amount of information. So before you get into a topic, you're like, okay, today I'm gonna study hypertension. Just go to YouTube Osmosis Hypertension. Just listen to the video. Normally Osmosis videos don't take more than 15 minutes. It's like 6 minutes, 10 minutes, 15 minutes. It's just an intro to a topic, but they are trying to be more detailed. So just go through that also. There are a few other YouTubers or YouTube channels that are actually good. So I have Osmosis, I have NinjaNet, I have Khan Academy, and I have Armando Hasadungan. I hope I pronounced the surname correctly. But these are my top 5 favorite YouTube medical YouTube channels. So yeah, I hope they could help you too, because they try to summarize most of the things. I know for Khan Academy, I use it mostly for physiology, and if I want to study something, I start Khan Academy physiology of 1 2 3 1 2 3, and then yeah, they try to explain into detail. So yeah, those are the tools I just want to share with you. Some YouTube channels that you can search mini topics or search topics before you can actually begin your study for the day. They can actually help you grasp information very quickly. So yes, and for surgical related modules, I would say all the time, if let's say you are doing surgery block and they're teaching you about maybe it's thyroid, so the best way to approach the topic in every surgical module, whether it's gynae, it's surgery, orthopedics, just start with your anatomy of the organ, go to physiology of the organ, then the clinical related conditions of that organ. So what I used to study, what I used to use, I used to use this. It's Grant's Atlas Anatomy. I'm still using it even today a lot, but today I'm also using more clinical oriented anatomy. It has more and Grants. They more or less compiled by almost the same people. Arthur Daly is also here, and Ane Aga. It's both on Moore and Grant's Atlas of Anatomy. The difference between the two is that with Grant's anatomy, Atlas of Anatomy, is that I'll try to show you now. They'll give you structures. As you can see, they'll give you structures, and at the bottom they'll try to explain what you are looking at and some mini clinical assessments that you can make related to that organ or whatever it is. Their pictures are actually huge. Like, you see, when they show you the ligaments, you'll see exactly you are what you are studying at that time. The only difference between the two, that has bigger pictures and it actually gives you a mini summary of what's happening or the relation of that organ that you'll be looking at. And with more, they give you more information. Yeah, I thought of that. They give you more information. So as I was saying, with more, they give you more information. Here I was studying cardiology, the cardiac. So let me just show you something, almost the same thing I showed you there. So you see, there's a colon. They give you more information on the side. So this is time consuming. If you are pressed for time, I would not suggest that you study more. But if you know that you're very disciplined and you start preparing for your exams at the beginning of the year, like you are on the go, you can start with more because it gives you more information at the go. With grants, it's also good. It's very good. So you can choose whichever you want to use, or if you are not using this already. And so, as I said, for your surgical modules, you can start with anatomy, then physiology, then you can go to your clinical related conditions related to that organ. For physiology, I was using, and I'm still using, this human physiology. It's by Pearson. So this is the company Pearson. There are different kinds. I know a friend of mine, I forgot the name of the book, who uses also a clinical physiology textbook or something like that. It's also good. So yeah, just get something, a physiology textbook that will explain, it's good to know this is the anatomy of the heart. Then after anatomy of the heart, then you go to physiology. This is how the blood flows from your limbs, brain, and everything. Then you can go to your clinical related conditions to that organ, and it makes things much easier because when you get to conditions, you will then know where the defect or the effect is. So yeah, that's actually my advice, or rather what you can use when you prepare for your exams. So when you're done with your anatomy, your physiology, and your clinical related conditions to that particular organ, then you can, after you have learned a clinical condition or whatever, then you can ask your peers or your study mates if they have patients in the wards that have such conditions. Then you can go to those patients and actually clock them and see if whatever that you have studied, the signs, symptoms that they presented with, it's actually in correlation with what you have studied. Then it makes things easier because your hands will not forget and your eyes will not forget. The only thing that we forget is just the theoretical part, but what you've seen and what you have felt, you will not forget. So it makes things much easier when you do that in that order: anatomy, physiology, clinical condition, then see a particular clinical related patient. So yes, I would say the more patients you start seeing, the more you get to be exposed to different conditions. Yeah, but don't forget, common things happen common, and the chances of them giving you a common condition, it's actually very common and very high. So don't overlook the common conditions and actually go for those far-fetched conditions that we see maybe once in a year in a ward, or once in 4 months in a ward. So yeah, I hope this mini let me see if I'm not forgetting anything. Yeah, I hope I have tried to summarize small details on how you can actually approach studying for your exam. And yeah, just to make things clear, um, so when you study, um, it helps to actually, after you cover the topic, to have a conversation with yourself. If you you can do that, have a conversation with yourself, or just have a reflection to say, okay, I studied hypertension, this is what I've learned. You are alone at that time. This is before you can meet with your study partners or your study mates. You can reflect to say, okay, I have studied hypertension. This is what I could remember from what I have studied just now. And you can see how much you have absorbed and how much you are still left to go back to and reflect and, yeah, catch up on. So that's one of the things I can add up to this video. Let me not take long. I hope this has been very helpful. Yeah, some of these things I used during medical school, and some I had wished that I had started using them earlier. I only discovered using them later, and they have helped me a lot and stopped me to be very haphazard in studying. And yeah, I hope you enjoyed, and I just want to say all the best for the year 2022 and all the best for the remaining years. And I hope you do great in your exams, pass with distinctions, and show them flames, child. And we'll meet on the other side of the corridors in the hospitals. Mwah.